Okay, so how do you think it's different? Because since we've been in the business for so long and you see other clinics and you see other practices, I mean, we got them all over the place, like behind our office,
Mhm.
just across the street. How do you think it's different from running a family business to running one of their corporate businesses? What do you think the differences are?
I'll tell you, one of the things that you and I always talk about is how we still engage
Mhm.
with our patients. So we've grown, we have multiple practices, we have an MSO, we do all these things, but we're still engaged with our patients. I think that stems from that family environment that your dad created
Mhm.
and he instilled in us. Because you don't see that. You
No.
don't see that.
Yeah.
One of the comments that I hear patients talk about all the time is how when they come in, they feel like it's family.
Mhm.
And I'm always like, well, this is family owned and operated.
Right.
Patty started this with her dad, and back in 1992, she's still here. Your son, Julian, he's our consultant. We ask him questions all the time. He's our tiebreaker. When
Right.
you and I don't agree on stuff, we ask him, and
Right.
he comes up with really good ideas. We have, my mom still works there. She's been there, what, 28 years?
28, I think it's about
28
28
years.
years.
My brother does the IT work. Our heat and supervisor manager is married to my cousin. So yeah, family
And what
owned and
about the
operated.
doctors too? We have
Oh,
like
and the
Dr.
doctors.
Garcia. He's
Yeah.
been with us the longest right now.
Besides your dad, he is our longest provider that's been with us because
Mhm.
you don't see that. That's another thing. He's been with us going on 16 years.
Mhm.
Running the family business it's difficult. I mean, there's the perks that, we don't have to answer to a corporate,
All right.
you know, but there's also how difficult it is, you know, it's difficult when you have all of these, private equity companies buying medical
Right.
practices or all these corporate,
Yeah.
people,
Very competitive.
very super
Mhm.
competitive. I believe that in Tampa Bay, Revello Medical is still the one and only original
Mhm.
primary care providers for humanity.
I think so.
I'm gonna verify that, but
There's
I'm not a betting man, but I would bet that they are, because nowadays you just don't see that,
mm-mm.
and I think that helps our providers, our doctors, stay with us
Mhm.
because they don't feel that pressure, that pressure that some of these corporate medical practices, and they make them see so many patients a
Yeah, so it's
day,
kind of like a
and there's
revolving
no
door,
exactly.
Yeah.
Ours is more of, we want our doctors not to worry about the business side of it. We just want them to take care of the patients, and you and I take care of the business side
Right.
of it. So we have, we've worked with people before that have sold
Yeah.
and have sold to the private equity companies, and we've talked about that, and it's just something that I just think, we still have it in us to
Mhm.
do it, and I think our patients appreciate that.
Yeah, absolutely. And
I,
it's
I
bring
think,
us things. I
yeah,
mean,
I think they like seeing you walk around and
yeah.
me, and
Well, there's that
it's,
patient who always says that, you just kind of walk around. Remember?
yeah.
He was
What
getting
does Tony do
photographed.
here? Tony doesn't do
He
anything.
doesn't
He's
do
always
anything.
hunting or fishing. He's never
And I don't even think you were here. You weren't there
I'm
that day.
working
I
with
was
it.
like, "What?"
So if you want to learn more about Revello Medical, you can visit us on the web at revellomedical.com or follow us on social media. We're on Facebook, Instagram, and TikTok.